Okay, thank you so much for tuning in. So who wants to pass the NCLEX with 75 questions? Or how about who wants to pass nursing school? I know how challenging nursing school can be, and for this reason, I've created this YouTube channel to help you pass the NCLEX, to help you pass nursing school. So make sure that you subscribe or hit the like button to get free educational tips. All right, let's get right to it. Medication that you must know for NCLEX. Here's a quick disclaimer that this is just for educational purposes only, and it's not intended as medical advice. Okay, so Lisinopril. What you need to know, the pharm class, it's an ACE inhibitor, angiotensin converting enzyme inhibitor, okay? We won't really get into the mechanism of that today. We're focusing more on test taking tips. The generic name is Lisinopril. You have to know your generic names for NCLEX. Trade names you don't need to know so much because NCLEX right now is purely generic names. So make sure that you know your generic names. Okay, side effects. I created a neat little acronym. That side effects of ACE, basically each letter of that drug class. A stands for angio, C stands for cough, E stands for edema. So when you put together the A plus the E, you get angioedema, which is a rare complication. These are the two most tested side effects. Of course, there are other side effects that this has, but this is what you need to watch out for the most. Okay, let's start with the cough. What does it look like? So a patient hasn't had this before, and they present to the office with like a dry hacking cough, and they'll be like, or it's just really dry. So you'll see it on a test as a dry hacking cough. We'll get into a little bit about how you need to answer the test question. Next is angioedema. Angioedema, this is drug-related angioedema. I'll show you a picture in a little bit, but it's the swelling that the patient gets. They almost look like they've been stung by a bee. It's a rare complication, but they like to test on it. The way I see it in my brain, and your brain learns by vision, by chunking, by visuals. So, for example, if I tell you right now, think of a trash can, you are going to visualize an actual trash can. You're not going to visualize the spelling of a trash can. You're not going to visualize TRASH. So I like to create these little mnemonics and acronyms and things like that to help you out. So there's a quick visual representation of how I remember the side effects for this. A stands for angio, C cough, E edema. This is a picture of angioedema. As you can see the periorbital edema, which is the swelling around the eyes, the swelling around the lips. This is a medical emergency, okay? We need to stop the medication. We're not giving the medication. So if a patient presents to the office with angioedema, we discontinue the medication. Obviously, you would tell the provider, notify the provider, and then they would go from there. But what you need to know for the NCLEX, usually the type of exam question that is going to say something along the lines of, patient presents to the clinic with a dry hacking cough. They've been put on recently, we'll say simvastatin, which is for cholesterol, and lisinopril, and we'll say maybe metformin. Which one do you think is responsible for this? Or patient presents to the clinic with a cough. What do you do as the nurse? A, tell them to put up with it, that it's a common side effect. B, do nothing, because we know how nursing tests are and they love to say the same thing in the answer choice a million times. So B, do nothing. C, do something else. Or D, notify a provider. So you're going to notify the provider. This is not something that they have to deal with. This is not something we say, suck it up. The doctor needs to discontinue that medication and order something else, because it's very annoying and uncomfortable for the patient. So by no means, if you see it on a test, the answer will be that it's an adverse side effect and we need to discontinue the medication, so you would notify the provider. Okay, well, I hope this helps. I included this funny little meme, nursing school is easy, false. It makes me want to die 1,000 deaths, because that is what nursing school feels like. So I hope this helps. Make sure that you hit the like button and the subscribe button. If you have any questions, make sure that you type them in the comments. That way I can answer them and help you out along the way. Again, thank you. Have a great day. Bye.